Good afternoon and welcome. We are glad you could join us to launch our multi-year project between WCHQ and Novo Nordisk to raise public awareness about obesity and to learn how we can deliver better care to patients with obesity. We will be starting our webinar with a video, which will be in the multimedia viewer on the right side of your screen. Click continue to view the video, then click to start the video if it doesn't start automatically. You might have to turn the sound up on the video player. When it finishes, click cancel below the player icon and exit the viewer. We'll allow 3 to 4 minutes to watch the video, after which we'll hear from our first guest speaker. So let's get started.
Hey, fatty, stop eating.
I don't want to judge, but if you realize that you're becoming bigger and bigger, maybe you need to do something about it.
It's a mindset thing. You just have the right mindset and you can accomplish anything.
Do exercise. Zumba, for example, like me.
I know, it's not politically correct, but
take responsibility.
I mean, they're not ugly, but
everyone has 20 minutes to do something.
Don't eat a burger every day, or I don't know.
just stop eating. It's that simple.
Okay, Bryce, just wanted to read from the teleprompter.
Right here?
Yep.
All right. I am here today to talk about something we have neglected for far too long. Why the SIBO?
WCHQ causes 2.8 million deaths every year.
It is heavily affected by our genes, the hormones, and the environment we live in.
And there is not a single country in the world that has reduced the number of people suffering from WCHQ for over 30 years.
When you suffer from this disease, it impairs your body's normal functioning and it is very hard to fix yourself.
Studies show that 40% of people living with WCHQ experience judgment and humiliation,
Making them feel ashamed and afraid to ask for help.
Today, about 650 million adults and 150 million children live with it.
living with WCHQ is a health issue, not a character flaw.
It is time to rethink what we know about obesity. Y'all could... Oh man, we talking about obesity?
Oh, it was back to front.
This is a joke.
I feel really bad. I technically body shamed him, kinda.
it's funny because we just judge, like without even thinking about it.
It's more than just a diet and exercise. It's really serious disease. I'm sorry, guys.
How does that make you feel?
I feel bad, like I'm part of the problem. They're sick, they're suffering, and I'm judging them and saying, oh, stop being lazy. Like even my own brother. But I ain't know. Like, I really didn't know, man. Like,
Well, I think it's maybe important to rethink how we can help people.
I hope you had a chance to see that powerful video. Welcome again. I'm Gabrielle Rude, President and CEO of WCHQ, and we are pleased for this overall presentation today. And to start, to have Renee Rawls join us. Renee is a Novo Nordisk patient ambassador. She's a mother and a grandmother, and today she'll share her story about her ongoing battle with weight. Renee, we are sending you a virtual welcome to Wisconsin. Thank you for being with us.
I wish individuals living with obesity knew that there's information out there that can help them overcome. You just have to find a healthcare provider to help you find the right type of tools. It's not just one tool that you may need, whether it's a dietitian, whether it's exercise, whether it's medication. The information is out there to help you because there's no finish line. That obesity is a chronic disease, and it's a disease that you would need help with for the rest of your life.
Hi, everyone. Good afternoon. Renee, thank you so much for sharing your story there. You're an ambassador and now an IT expert as well. So you got it figured out eventually. So thank you for sharing that. I mean, the challenges and the struggles and the successes, and you know that, you're not alone with that, right? Everyone on this call knows that you're not alone with that. Our patients struggle, our community struggles, but there can be success, like you just talked about. So it's the reason I'm very excited for this partnership here. So my name is Christopher Weber. I'm a physician and a bariatric medical director for Ascension, Wisconsin. And obesity has been described as a disease since 2013 when it was recognized by the American Medical Association. It's still not as well understood as many other diseases, and it's often not accepted as a disease by providers and by the community. But here in Wisconsin, we can change that, right? Through education, sharing best practices, measurement, improvement, advocacy, and outreach. And this is, it's a tremendously complicated disease, right? And accordingly, it takes support from different groups, different people to lead to significant and meaningful and long-term improvement. In my practice, for example, we use medications, we use surgery, psychologists, physical therapists, nurses, dietitians. So it's a whole bunch of people that we use to address this disease. But we also need help outside the clinic walls. And so that's why I was so excited to hear about the WCHQ and Novo Nordisk's partnership here on this incredibly important topic. And I'm really looking forward to seeing the health of our community improve because of it. So thank you again for sharing your story, Renee, and I'll turn it back to you, Gabrielle.
Thank you, Dr. Weber. Thank you, Renee. Very much appreciate both of your participation today. I'd like to give a little bit more overview of the project that Dr. Weber just referenced so that we can understand what it is we have planned for the next few months. So one moment while I share my screen. And I'm not a tech expert either, so I will rely on my colleagues to let me know if I've shared the wrong screen with you here. But again, I'm Gabrielle Rude with WCHQ. Very excited about this project. Look forward to the next steps. So we just heard a very real story from Renee and saw that powerful video. If you had any trouble viewing it or would like it, we'd be happy to provide a link to it again later if you can't find it. But we here at WCHQ found that incredibly powerful as we think about how do we help with this pandemic of obesity. So we know this, it's one of Wisconsin's and our nation's most challenging health issues. The majority of health systems and hospitals have identified it as a top priority in their health needs assessment. And we know it's a contributing factor to other chronic diseases like diabetes, hypertension, et cetera. But then as we've just talked about, it's obviously a very difficult condition. There's a stigma specifically that prevents people from seeking care. But then also, as Renee described it, it's not an easy or a quick fix that you can just take a pill for and have it be resolved. So WCHQ is very excited about this project. It brings new resources to our members for something that they've asked us to do for some time. These resources will allow us to provide general obesity education at our assemblies someday, which will be held in person again. Our ongoing improvement groups will be able to provide more communication about tools and resources to our members. And then through this partnership, we will have access to experts like those on the call today available to WCHQ members. With those resources also, we'll be working to develop measures with member input. This is the important part of what WCHQ does to drive our work, is to develop measures that we can use to measure improvement and identify opportunities to learn from each other. And then when that data is available, as is our normal process, we are envisioning that we'll create an improvement team which will meet regularly to focus on providing better care for those with obesity. This is a brief and high-level timeline of what we're envisioning doing. So starting out with building awareness and member education, identifying opportunities. We are aiming to do something new. So this is an opportunity for our members to step up and communicate about what they need as we form this project. We'll then work in the second year of the project to develop these measures, to test them, again with member input. Ultimately, we aim to publicly report those measures at some point, but this is all in conjunction with our members. The improvement teams will be formed in year 3, and we're envisioning having an obesity summit. This is a type of meeting we've hosted successfully in the past where we bring together like-minded individuals to discuss the project and think about how we can move even further towards improvement. And then, as I mentioned, in year 4, we're going to add it to our portfolio to make it available for our members' use, and beyond that to think about whether it becomes public or how it is utilized after that. So if you'd like more information on this project, we are in the early stages of finalizing the details of the project, and we'd very much like member engagement in that. So if you want to provide input as we develop our project plan, feel free to contact Jen Koberstein. She is the project manager for this, and her email is listed here. So now I would like to introduce our next speaker, Sean Hansen from Novo Nordisk. He is the Medical Accounts Associate Director and Manager Markets at Population Health in Wisconsin and Minnesota. We're thrilled to have him talk about the partnership. So thank you all for being here. We look forward to your presentation, Sean.
Thank you, Gabrielle. First, I want to thank Gabrielle and her team for all of their hard work on this project. Thank you, Renee, for your inspiring presentation. And thank you, Dr. Weber, for your insightful clinical perspective. Novo Nordisk is excited and proud to support WCHQ on this groundbreaking multi-year project. This project expands upon our work with the AMGA, the American Medical Group Association, to develop relevant clinical measures for obesity and help fulfill our long-term commitment to improve the lives of people with obesity by changing how the world sees, prevents, and treats obesity. To echo Dr. Weber's comments, we know obesity is a serious and chronic disease, yet it's often difficult to discuss in a single medical visit. It's important to have standardized processes and treatment regimens in place so people with obesity are able to talk about weight with their healthcare providers and work together on an individualized and complete care plan to help lose weight and keep it off. Our partnership with WCHQ is aimed at addressing this unmet need in a unique way that could transform the management of obesity and potentially improve the clinical care of patients throughout Wisconsin. In conclusion, Novo Nordisk is dedicated to making obesity a healthcare priority. And if you would like to learn more about our commitment, please visit our Changing Obesity website. The link will be shared via the WCHQ newsletter, but you also may simply internet search Novo Nordisk Changing Obesity and it'll pop right up. We very much appreciate your attendance. And with that, Gabrielle, I'll send it back to you.
Thanks, Sean. Very much appreciate the partnership. I want to thank all of our speakers today, Renee, Dr. Weber, Dr. Hansen, all of you for being with us, and thank our audience for your attendance. We are looking forward to this partnership in the future and for the input of our members. So as was just mentioned, please watch the WCHQ newsletter for more information on the project. You can reach out to Jen Koberstein if you are interested in providing early input onto this work, and we'll have some other communications coming out regularly. Thank you all for being here. Have a great day.